The CDC publicly tracks transmissible diseases, and one of them is influenza. Each year, the season's influenza rates are tracked and followed in this CDC database. They're tracking visits to the physician for influenza-like illnesses, positive tests, hospitalization rates, and deaths or mortality. So I was curious to see if the data reflected what we were all feeling about the rise in cases and hospitalizations. I have observed quite a few cases of respiratory illness so severe from influenza that I've had to admit younger and older people to the ICU more frequently. Some of these patients were not needing to go directly to the ICU. They had to go in to the medical surgical unit for supplemental oxygen. You and I are breathing at around 21%, but these patients aren't able to oxygenate. And despite having the additional symptoms of fevers, chills, night sweats, myalgias or body aches, they're still suffering, so they come in and they can't breathe. Chest x-rays may or may not show pneumonia in addition to the influenza. They test positive and then they're treated. This particular site is the national, regional, and state level outpatient illness and viral surveillance data through the U.S. Influenza Collaborating Laboratories and the National Respiratory and Enteric Virus Surveillance System. This data is reporting the total number of respiratory specimens that tested positive for influenza type A and B each week to the CDC. Not all the laboratories were identifying subtypes of A. And for the outpatient surveillance illness, they're looking at a percentage of visits to the primary care physician's office for influenza-like illnesses. This data was collected through the outpatient system, or Illines. If you take a look at this data, this is a percentage of visits for influenza-like illnesses, and this is a national summary. We're looking at the years 2025 to 2026, and the data here shows that at week 52, we had 8.27% of visits for the reason of influenza-like illness. Now, influenza-like illness can include symptoms that mimic influenza but are from other viruses or other conditions. There are a lot of other respiratory viruses such as human metapneumo, enterovirus, and RSV, and we get quite a few of those. Rhinovirus is another common virus that can contribute to symptoms that may mimic influenza, and people can feel bad with those other lesser viruses as well. So we have this peak at week 52, and week 53, which overlaps the last week of December and January, we have a slight drop at 7.15%. When I compare this to 2024 to 2025, you'll see that at week 52, we did have a peak, but it was at 6.74%. And the week after, it was 6.25. So already we are seeing a difference, a rise this year in the percentage of visits to the physician's office for influenza-like illnesses. When we look at the data for actual positive test rates, for the years 2025 to 2026 flu season, we see a rise in week 51 with around 3,000 to 3,500 total tests. Comparing that to 2024 to 2025, week 51 and 52 actually had around 5,000 to 6,000. So although we had a higher test rate or a higher positive test rate in 2024 to 2025 for flu, we actually had fewer visits for flu in 2024-2025 than we do this year. What does that mean? Well, the positive tests are less this year, so it could be that we're diagnosing other illnesses. The CDC also collects data on hospitalization rates, and as a hospitalist, this is of unique interest to me. So the agency that collects this data is a National Healthcare Safety Network, and this tracks data of hospital admissions and rates by week. This monitors trends in healthcare system stress, capacity, and community disease levels. And they report the data from approximately 6,000 hospitals. Now, when hospitals are building and they plan, they're usually planning for peak demand, such as of seasonal variability. We're talking about flu and COVID surges, and operational constraints, such as staffing, boarding, and throughput. Well, the data here represents laboratory confirmed influenza infection in patients diagnosed with influenza and having a positive test within the previous 14 days. These tests include molecular tests, such as PCR, nucleic acid amplification tests, immunofluorescence and antigen tests, and in very few cases, viral cultures, which anyone rarely does because they are just so hazardous to collect. For hospital reporting system, the influenza is categorized as either A or B. Now, one of the questions I had about this data is, does it include observational or observation patients? Patients are usually admitted to the hospital under two statuses. An inpatient admission is a full hospital admission, and an obs stay or observation stay is a short hospital visit. And I've admitted people under a short hospital stay for very mild influenza-like illness symptoms. So according to this data, this one's pretty simple. We have a vertical bar graph that shows the total number of influenza hospital admissions, which is an aggregate in this particular example. And then we have an influenza hospital admission rate per 100,000. So for this flu season, our rate per 100,000 is 11.9 cases, and influenza admissions are 40,240. Comparing that to 2024-2025, we didn't really have as many. In week 52, we had around 28,633 cases, and then we had 39,609 cases by the first week of 2025. So it's getting up there. There is a slight increase for this year, but it may be negligible, so we just have to have more data. The final data that I was curious to look at was about mortalities. And yes, the CDC tracks this data as well. This is reported. They collect this data from the state's vital statistics registries. Vital statistics often have birth and death information. When a patient dies in the hospital and I've been taking care of them, I will complete a death certificate in my state's electronic health system, and I am asked to provide a cause of death with 3 additional spaces for 3 additional diseases, 3 to 4 additional diseases that could have contributed their death, their actual cause of death. And so what the CDC does is they are looking for 3 primary diagnoses: influenza, pneumonia and influenza and COVID. And according to this particular data, they plot out around 4 to 5 years of data. And we can see 2024 to 2025, where we've had a peak in around week 7, with the percentage of deaths due to influenza being 2.79%. And influenza coded deaths were around 1,872. We don't really have enough data. And from the little bit that can be seen, which is difficult, we can see quite a rise. So far, for week 53, the percent of deaths due to influenza is 1.87. And in comparison to 2024-2025, if I go to week 1 and week 2, we actually had around 1.18. So it seems like it's almost the same. So I hope you guys like this content where I dived into the CDC's reporting of data. I use the CDC a lot during our COVID years, and I learned a wealth of information that's reported. It is helpful on a local level for hospitals to plan in terms of staffing and other operational needs. Please don't forget to give me a thumbs up and subscribe. Share this content with anyone that would find public health reporting data interesting. And until next time.